Uterine fibroid embolization is a minimally invasive technique that is used to treat symptomatic fibroids. It involves making a small 2 millimeter incision in your left wrist and going through your artery down to the arteries supplying the fibroids and putting particles to kill the fibroids, and this alleviates the symptoms from the fibroids. The ideal candidate for uterine fibroid embolization is a woman who has fibroids which are symptomatic, resulting in heavy bleeding, as well as patients who experience severe pain together with the heavy bleeding, and also some women who have very large fibroids would also benefit from the embolization. Outcomes for heavy bleeding for embolization are similar to surgery. You avoid a major cut or a major incision, and also the recovery time is much shorter, so you only spend one night in the hospital and you're home. You basically take around 2 weeks to recover from the procedure, compared to surgery where you would be recovering for a significantly larger number of weeks before being back to your normal life. Practically all types of fibroids respond well to UFE. We normally ask patients to carry out an MRI to map the fibroids and determine if they are good candidates for embolization. The procedure is done under anesthesia, so there is no pain experienced during the procedure. When the patient comes in for the procedure, the anesthetist will put them to sleep before we start. The procedure takes around 45 minutes. When patients wake up, they will be on medication to control the pain, and we recommend patients staying one night in the hospital before going home to manage their pain before they go home. There are several things that can go wrong with the procedure. They don't always occur, but it's good for patients to be aware of them. Number one is internal bleeding, because we are puncturing an artery. Number two is injuring any of the blood vessels we are going through. Number three is what we call non-target embolization, if particles that are meant to go to the fibroids go to any other part of the body. That virtually never happens because the particles are mixed with X-ray dye, and we are doing this under X-ray guidance, so we are able to track and make sure that all the particles are going to the fibroids. Number four is infection. Number five is premature menopause. Again, it's extremely rare because the ovaries have their own blood supply and the uterus has its own blood supply. So extremely rare for us to induce premature menopause. Number six is post-embolization syndrome. Now this is something that all patients experience after embolization, and it consists of pain, cramps, muscle aches, joint aches, nausea and fever, and lasts for 1 to 2 weeks. The good thing about these symptoms is that they're all manageable by medication.